This is the other money for our needs assessment. The Mental Health Board is called to order. It's July the 19th, 2007. We want to make a motion to approve the minutes. Everybody read their minutes.
Madam Chairman, I motion we approve the minutes of the last meeting.
And our secretary is not here tonight, so we're going to keep some records for her, Miss C. Okay, someone second it?
I second.
Okay. Mr. J. Do we have anything under 2/3 emergency? Public comment. Status report from the Gonzales-Donaldsonville Mental Health from the state, and that's going to be Miss Murphy.
Yes, ma'am.
It's nice to see you tonight.
Hi, it's nice to be here. I'm Brandy Murphy, the social work supervisor with Gonzales Mental Health. Our manager, Mr. Ryan Reif, is away this week. I passed out before the meeting the statistics. Do y'all have any questions about that?
I don't have any. Anybody have any questions? No questions, Dawn.
I think there was a little bit of leftover business from the last meeting about, there was a question about how many children we see. We have 98 active children's cases between the two clinics in Gonzales and Donaldsonville. And really the only other thing I have to report is that we've been, we changed our days in Donaldsonville to Tuesdays and Wednesdays instead of Tuesdays and Thursdays, and the clients all seem to be adjusting very well. We haven't seen any problems with that thus far.
Great.
Any questions?
No questions.
Okay, thank you.
Thank you.
Thank you.
And now Dr. Susan Menendorf with the Parish.
Thank you. On your report on our service statistics for June, we made 248 more appointments in June of this year than we did last year, and we served 192, provided 192 more services this year than last year. That's in the new column on the right. At the bottom of the report on the first page, Donaldsonville services, I made an error in tabulating that. The total hours of services were 15, not 13.
Okay, you saw 8 clients in 4 groups. There was 8 in each group, and
no, there was a total of 8 clients, so there were probably 2 in each group. It varies.
Oh, okay, a total of 8 clients. So, and you had 4 group meetings. So that meant, and what is for 13 times?
That was a mistake.
Oh,
that was a mistake. I'm correct.
Okay, I couldn't. So that just doesn't belong there?
Yeah, just scratch that out.
All righty, gotcha.
Under clinic collections, we're running our aging reports and analyzing them. So Mrs. Gautreaux, you asked for some specific information. We'll give that to you at our budget meeting the second Wednesday of the month. Under grants, we received our awards for 2007-2008. We received $25,000 from Governor Safe and Drug Free. That's a decrease of $15,000. All of the Governor Safe and Drug Free grants were decreased. They told us going in that no one would get more than $20,000 or $25,000. Our capital area prevention grant was increased by $2,271. It's a total of $40,131 over last year's $37,860. Our capital area treatment grant was increased from $60,000 to $74,000, And this was in response to our request that we receive more money based on our larger population than the other parishes served. Also, with the understanding that we offer an intensive outpatient treatment program, which we're going to do. And we have to plan that out first.
What is that?
Intensive outpatient treatment is a minimum of 9 hours a week of programming for substance abuse clients. We offer 10 hours a week already, but we offer it in 2 tracks. So they gave us permission to combine our tracks so we don't have to have a new staff person to do it. We can use our existing staff. We just have to tweak our programming a little bit.
But all patients come to the office?
All patients come to the office. It's going to be late afternoon and early evening, and some patients will be in intensive outpatient, some will be in regular outpatient, some will be in aftercare. So we have a variety of different. Think of it like steps on a ladder, and you work down the ladder as you fulfill your obligation at each.
Okay. Well, when you
level.
were saying outpatients, I was wondering if we were going into the homes or.
Oh, never. No.
Okay.
I'm sorry, not never, but not residential.
Not residential. Oh, right. Got it.
And we have a little bit different licensing requirement for intensive outpatient, but we shouldn't have any trouble meeting those requirements.
So what you're saying, we have an increase in these grants due to population-wise?
Well,
as far as people we see, or as far as what? In the increase of funds?
we had asked that we receive an increase from capital area because we have a large population base in Ascension, and my understanding is that was the reason.
So what impact would this have on the west side as far as programs is concerned?
We'll continue to offer our services on the west side. Those are covered by our contract with capital area, our substance abuse treatment. It's not a new program that's starting. They never paid us enough to cover the program, the cost of the program. They only cover about probably less than half of the cost of the program.
And on this, excuse me, Jerry, you finished? I'm sorry.
Yeah.
On this governor's drug and
Safe and drug-free.
safe and drug-free, on the report that we have here, did we not spend that $5,719.81? There's a balance there.
I'm sorry, have you gone on to the grants reports?
Right.
Oh, okay.
Where we balance and the remaining balance.
Oh, right.
And the date has run out. Do we have?
No, we weren't able to spend that because there's a point after which you cannot rebudget. In other words, you have to spend things according to your budget. And at about the 6-month mark, you look ahead and see that everything can be spent, and if not, you can request a rebudget. And we did that last year. They approved it, but then they delayed it so long that by the time we got it back, we weren't able to do it. I think our Strengthening Families coordinator went on vacation, like 2 weeks. That was some time we weren't able to pay her for. So she works by contract, so we only pay her when she's there. She's not a salaried employee. And it was too late to request a rebudget, so we couldn't switch that to supplies or anything else.
So we having to refund that?
Right, we are. That's very unusual for us. We usually spend it out to the last penny. But that was the grant that they held up so long, our initial rebudget request.
Okay. I would think we would be looking forward enough to know that we had that amount. To spend.
It happens sometimes. We don't like it, and we prefer for it not to happen.
Okay, I have a question. Under grants, Section A, the Governor's Safe and Drug-Free Communities Grant received an award of $25,000, $15,000 less. Is that the reason why we're getting less, because we're not spending?
No. The reason we're getting less, this is federal pass-through money. The state of Louisiana, all the states got less from the federal government to pass through on their contracts. They told everybody this going in this year. This amount has been decreasing, and the federal dollar for substance abuse treatment is going to decrease drastically over the next few years. It's important to understand that the federal government has one block of money that they give to social service and mental health type grants. and schools, and it varies every 4 or 5 years. It shifts from one topic area to another. Used to be AIDS. Used to be substance abuse has had its day. Now we think it's moving on to emphasis on the schools with the buildup of interest in mental health. And this is a direct result of the school shootings and the turmoil in the schools. So that's the reason for that.
Okay, so you mentioned that something wasn't reapplied for a time, so this is why we're losing the $5,700 and some dollars. Who's
No,
responsible?
what I said was that we were working according to budget right until the last part of the grant year, and we had some unforeseen reasons for not being able to use up the rest of the money. I'll ask next time to get the specifics for you.
Okay, so
But there's a point at which the state cuts off a rebudget request, so we can't switch it. We can't do a line item transfer. at
right,
that
I
point.
understand that. So who's responsible for the
I'm responsible for
unseen-
everything that happens in the clinic. So that happens under me.
So you don't think it's a good idea to have to turn money back in?
No,
do
of
you?
course
Okay.
not. The last part, I'm not sure whether you had this on your agenda or not. This happened after I think we sent out the report, but I received a call from the president of the Ascension Parish Hospital Board saying that she had $50,000 a month to offer for a mental health program, and asked if we would be interested, and I said of course we would be interested, and she wanted a proposal for this month's meeting, which was earlier this week, I believe. We couldn't have gotten it ready that soon, so she's asking that we have a proposal for next month's meeting, the August meeting, which is the third Tuesday of the month. And so I would like the board to decide how they would, what sort of proposal they would like
Or
to make.
depending on what type of program you want to have to fund it.
Well, I talked to Cynthia about a half an hour ago, and explained that we were doing this needs assessment, and she knew a lot about a lot of grants for mental health that Shreveport's getting. She's got a lot of good information for this board. So I invited her to come to our needs assessment meeting on August the 6th, if y'all all approve of that. She's with this mental health for the Ascension Parish Hospital over here. And well, we don't need a motion or anything. We just, if y'all approve, it's okay for her to attend that meeting. And she said she would hold off her funds until we have a program, and we will work with her to get that program, because she said that there is lots and lots of money, federal and state dollars, in mental health that we should be getting in Ascension Parish that we're not getting, and she can help us with that. So I invited her to participate in our needs assessment. So that's fine with y'all.
It's okay with me?
Thank y'all. And Susan, we talked to her, and she's going to meet with us, and we're going to come back, and she's going to hold that open for us.
Good.
Whatever
Good.
program
That's very good
we
news.
come up with.
Okay, so the board is gonna direct those efforts.
Well, with your help, we're going to all work together. But yes, and she said it's not that. She really didn't want us to go out and push the issue about the money and all that, because she said everybody will be after it. So we want to just leave it as is for a while. Thank
Very
you.
good. Well, I'll wait to hear further from her.
Okay. Well, we're going to hear from her. We
Okay,
will.
very good. Under policies and procedures, I finally heard back from Judy Girolando, the health care attorney. She went through our policies and procedures again. Again, it's the first time for her, but probably the third or fourth time for us. And she had many, many changes, so I've done them all, her requested changes in red lines, so it shows what was there and what she suggested taking out and what she suggested putting in. So it's not going to be fun to read. As soon as I'm waiting on one more piece of information from her, then I'm going to send it to Jeff Diaz, and he'll read it again, and then I'll bring it to the board. So I'm hoping to have that for the August meeting. I was disappointed to have to spend several more days and weekends working on this, but she made some very good points. And her her way of looking at it is, can we defend this in court? If something happens and it has this wording, this is not defensible, or this is not clear, or this is too clear. Many things she felt we had provided too much information. So that was a type of expertise that, I don't have. And Jeff Diaz's perspective was, is it consistent with board policies and the ordinance? And so everybody's looking at it from a different standpoint. It was very, very helpful to talk to her. We spent probably a total of maybe 8 hours on the telephone spread out over several days. So it was very painstaking. We went line by line through the whole 109 pages and all the appendices. So we should be fairly well set with the policies and procedures when they come back to you.
Okay, we're grateful for that. That's all we were saying in the first place, is that everybody knew what was going on. So you're going to send it to legal.
We're going to send it to legal.
Then it's going to come back to us.
And do you want the red line copy, which is a nightmare to look at, or do you want it after he approves it and we take out and then give you something polished?
I would suggest we take it after they take the red line out, because we're not going to put it back in after a lawyer tells you to take it out.
After 2 lawyers tell us to take it out.
You see what I'm saying?
We want the approved version.
Yeah, we want just
you want the approved version.
The
That's
clean
what I'd
version.
recommend. Right.
Okay.
It stretches on for 125 pages.
I have a question. We want the clean version, but we had the clean version the last time. And there were
that's
some
true,
things
too.
that we disagreed with that.
Well, you
just,
can disagree
and
with anything.
And what I'm saying is, I'm thinking that the legal attorney that's doing it now saw the same things that we saw.
Could be.
Okay, because that was the reason why we wouldn't pass some of those things, because of some of the things we saw in it. We're not legal people, but we know the law.
But you did pass it, didn't you?
No,
I thought
we
you
didn't. No.
Oh, okay, it's never been.
No, it just went on to legal.
But we passed the legal copy that we received.
Yeah, you all
After the
approved
After
fact,
Jeff, yeah.
after 3,
Yeah.
4, 6
Yeah.
months or whatever. I'm just saying we don't want to run into some. If the league is going to do the research on it and is going to pass it, we really don't need to see it. We just need to see it before, with the red lines in it and all of that in it, so we'll know what's been changed and what it looks like and what it's supposed to look like. Because if we find something, there are some things we found in it that we were able to help legal with.
Good. Well, that's very good, and we have all of those. I have all of those drafts pretty much on file, so I'll get that to you.
Perhaps send us one copy and we'll get everybody else one, or you can give us
We'll
all
pass
one.
it around.
Yeah, pass it around. Okay.
Will do. Under contracts and letters of agreement, you asked me for a list of all the current contracts, and I grouped them together. You have a one-page there in your packet with the letters of agreement grouped together, and then the contracts that, these are the contracts that we engage people to do services for us. These are not the contracts that we have, say, with Capital Area. That's something different. Okay?
How many contracts do we have? Those kind of contracts?
2.
Just 2, the one with Capital and the
Capital
one...
Area Treatment, Capital Area Prevention.
Prevention. Okay, well, we have an intergovernment agreement with the parish to do our budget. That's the only intergovernment agreement we got with the government?
Well, Capital Area gives us a contract. It's essentially a vendor contract to provide substance abuse services. And they call it a grant. We call it a grant.
Yeah.
But I'm just saying that's not included on that. You already know about the. These are the contracts that we have with other people.
Okay.
And if you have any questions, please let me know. And the last thing is that we need approval on the FIN's letter and task letter of agreement for use of the Donaldsonville office spaces. You have a copy in your packet. I made 2 changes in that contract. I changed the number of offices from 2 to 3. And I changed the parties in agreement. In last year's letter of agreement, it had my name instead of the board name, so I took out the agency and inserted the board or
But that contract is not due till August the 31st.
Right, but all
And
this
you can
office
change the
space,
due dates.
all this office space, and we haven't seen a child yet.
Right.
I don't understand what's going on.
Well, when
It
it
needs so much of space, but
why
the
don't
children is not getting seen.
Exactly. So why don't we wait till we get our needs assessment, and we've
That's it.
got all the way to August the 31st to approve that
That's
contract.
it. I'm not going to approve that. I'm sorry.
Okay. All right.
I agree.
Agreed.
Based on the fact that we may need our offices after we do our needs assessment.
That's fine with me. In your packets, I included some information on the Louisiana Public Bid Law that was just distributed to parish employees recently. I put a list of the crisis hotline numbers that we're submitting to Channel 21 as just a public information graphic, and then we're putting them on our website, suicide hotline, crisis. It's not related to our agency. These are community and Louisiana crisis numbers. Okay. The last thing that I have is a presentation on the 2006 Ascension Parish Caring Communities Youth Survey. Our prevention grant with Capital Area requires that we disseminate this information to the public, and this is an excellent public forum. I'm going to keep it really brief for you, but I'd like to, if it's okay with you, I'd like to go ahead and present this information. Question, Mr. Butler?
Anybody have a question?
Yeah, I have a question before you get to that. I see something here, rock from lawnmower, broke window car in parking lot, handled by Parish safety officer. Could you brush me up on that?
The parish lawns, grass cutting people were cutting the grass and it threw up a rock and broke somebody's window.
I just don't
And it
want
was
us to get charged for
$400?
it.
I don't know how much it was.
Yeah, but we shouldn't be charged for that.
It goes to the parish to
Well, I
handle.
read somewhere it costs $400.
Make sure it's not in our budget.
All right. Yes, sir. I will
Because
check
they'll
into
fool
it.
around and have us paying for. Yeah, it's not taking out a mental health budget to pay for somebody else window pane, because I don't think nobody from mental health was riding a lawnmower to cut the grass.
No, you're exactly right.
I just wanted to make sure you clarify that with them. Let them know that.
I prefer to get them to cut the grass early in the morning before people come, because it's really sort of a
But not
danger.
just that. I mean, it can shatter and hit the glass at the building.
I thought it was a building
see,
glass.
but-
myself.
No,
you
it was
But I just don't want mental health to get charged for somebody else's
We'll
action.
check the activity sheets when they come out. If they're on there, we'll have it taken off. Okay, any other questions before I go on to the Caring Communities Youth Survey report? Thank you.
Oh, excuse me, the tree also that they want to take down because it's jacking the roof up or causing them problems with air conditioning. I have no problem with them taking the tree out. What
Where?
about y'all?
Where's
There's a
that?
tree in the
Courtyard.
courtyard at the building, and the maintenance claims it's too big and it's becoming a problem in there. So they have umbrellas and tables in the courtyard. They don't.
Well, it looked like we had a problem with all air conditions everywhere.
Yeah, right.
I see in this report another one that went out in.
Well, that one I understand.
Is this the
was
same
future
one that we-
maintenance.
This is a new one, a different one. Not a new one, but a different air conditioning unit.
What, did they just find leaves and stuff in it where it hadn't been? The maintenance people hadn't came
I
to
don't know
check
the
it.
answer to that. Celeste is not here. She handles that. So.
Yeah. So we need to make sure that our maintenance people do check those units as often as they're supposed to, in case it was leaves and stuff that or debris that's causing us to burn up so many of them. Okay.
I think probably the issue is mostly that they're old and wearing out, but I don't know. So Celeste will check and see. Let's. I'd like to start this report. I don't want to keep you all here all night.
Okay.
So this is our Caring Community Youth Survey report. This is a report that's given all over the state every 2 years to children in the 6th, 8th, 10th, and 12th grades. And essentially it follows a class through. So the 6th graders take it in the 8th grade, take it in the 10th grade, take it in the 12th grade. And it compares 6th graders in 2002 with 6th graders in 2004 and 6th graders in 2006, and each class on from there. In my report, I'd like to talk a little bit about the survey, how it's administered in Ascension, what our results were, some of the state and national comparisons, the risk and protective factors, and a little bit about community profiles. The CCYS is a national survey. It's been administered in Louisiana since 1998, so this is something that we have used for a very long time. Interestingly, not every parish in the state would allow it to be given. The rural parishes had some real difficulty accepting it because of the small populations in their schools. They felt that potentially would identify problem students, and they didn't want that. But now I think everyone is on board. It's been given in Ascension for several years, and we have data tonight beginning in 2002. The survey presents actual behaviors as reported by the students. It also presents risk and protective factors, and I'll explain to you what that is. The risk and protective factors are divided into 4 domains: community, family, school, and peer and individual. The risk factors are negative factors that affect or impact a student's learning and development. And these are factors that we know from research suggest that a child is at increased likelihood to use drugs, to be delinquent, to drop out of school, and an increase in violent behavior. Some examples of risk factors would be, in the community domain, would be a low neighborhood attachment or a high level of mobility. Families that move in, move out, don't stay in any particular community. In the family domain, an example would be a family history of antisocial behavior. It could be a family history of conflict and poor family management. In the school domain, it's academic failure, low commitment to school. There's several others. This is just an example. And in the peer or individual domain, it's early initiation of antisocial behavior. The earlier a child gets into trouble, the more likely they are to have difficulty down the road. Rebelliousness is another one. Protective factors are just the opposite. Protective factors buffer a child against some of these negative forces. An example of a protective factor would be a strong bonding to family, regular attendance at religious services, community activity, healthy beliefs, and clear standards, clear family standards for behaviors. Types of data presented. We have substance use charts, antisocial behavior and gambling charts, risk factor charts, and protective factor charts. And we'll go through those. The 2006 Ascension student group was composed of 3,670 Ascension students. That's a very large group of students. They were 48% male, 51% female, not quite half and half, but close. And racial and ethnic groups pretty much divided along the lines of the parish as a whole. There's certain measures that you need to understand in, oops, I lost this one. Sorry. In looking at these profiles that I'm going to show you, lifetime use obviously is any use of alcohol or drug in a lifetime. These are the kids that have a couple of sips of champagne at a wedding. That goes down as lifetime use. 30-day use is a measure of alcohol use or drug use at least once in the past 30 days. And this is a very good measure of current substance abuse. So we have good research to tell us that if one of the kids who's taking the test, taking the survey, says that they use drugs, substances, alcohol in the past 30 days, it's likely not to be their first or last time. Binge drinking is heavy use. That's defined as 5 or more drinks in a row, 1.5 packs of cigarettes a day. And antisocial behavior is engaging in any one of 8 behaviors that we'll look at in a little bit. In looking at the data tables, I apologize, they're a little bit small. I gave you in your packets the blow-ups so you can see them more clearly. The bars on the table reflect the number of students reporting those behaviors, and they're divided. They come in groups of 3, so it's 2002, 2004, 2006. The little dots that you'll see on there are, that's the measure for statewide use on each individual measure. And there's a little diamond, that's national use. I didn't find that very helpful. I'm really looking more at statewide use. We're going to look first at the drug use profiles. They'll be for 6th grade, for 8th grade, for 10th grade, for 12th grade, and each one will show first the gateway drug use, and a gateway drug is alcohol, tobacco. Gateway drugs are alcohol, tobacco, marijuana, and inhalants. So if you look at the first profile, we're looking at 6th grade students, and what this really shows is that from 2002 to 2004 on lifetime cigarette use and lifetime alcohol use, we see a real decline. This is good news. And the rest of the usage for 6th graders is pretty low. But I would call your attention to lifetime inhalant use. Inhalants are the drug of choice for 6th graders, unfortunately. Under other illicit drug use for 6th graders, you see very little except for sedative use, downers. Under the drug use profile for 8th graders, you see every year it goes up. More people using more things. But the good news is that from 2002 to 2006, it's going down some. And in order for it to be a significant decrease or increase, it needs to be a change of about 5%. And I noted those on lifetime alcohol use and lifetime marijuana use and lifetime inhalant use. You will see the use of inhalants go down as the kids get older.
Sorry, could y'all turn off your cell phones, please, if you have any other one? Thank you.
Under other illicit drug use profile, we see pretty low use for 8th graders, but an increase in sedative use. For 10th graders, you see, more kids doing more things here, but overall it's still coming down. It still shows that downward pattern that we like to see. Alcohol use is skyrocketed here by age. Inhalant use, of course, is going down because 10th graders get into better stuff now, at least what they would consider to be better stuff. In the other use profile, you'll see these categories that were so low with some of the younger kids coming up, especially sedative use. Look how high sedative use is. 12% of surveyed 10th graders report this. That seems an awful lot to me. I think 2 kids must have a little money because they're able to buy marijuana and things of that sort. Now, in the 12th grade, it goes very high. It goes all the way up, lifetime alcohol use to 80.5%. But again, it doesn't decrease, lifetime alcohol use doesn't decrease as much as we'd like to see it from 2002. It's almost steady. Past 30-day alcohol use has gone down some, and lifetime marijuana use has evened off. It's way above state levels, though. We are, on some of these factors, uncomfortably far above the state level. Under other illicit drug use profile, the parish is above the state on just about all levels here, which is kind of disappointing. Now, these are small for the most part, but some are over the 5%. Now we're going to switch gears and look briefly at antisocial behavior profiles. Beginning with, this is a split graph, 6th grade on the left and 8th grade on the right. We see that about 20% of our 6th graders were suspended from school. This is usually for drugs or antisocial behavior. In 6th grade and 8th grade, I find that kind of depressing. I think that's kind of sad for kids that young to be suspended. We also see toward the end of the 8th grade chart and the 6th grade chart, we have 19% in both grades said that they attacked to harm somebody. I think that's terribly concerning. They attack to harm with the intention of harm. In the antisocial behavior profile for the 10th and 12th graders, we see pretty close to the same thing. We're the same or slightly below the state, except on one measure of drunk at high school. We're above the state. On the gambling profiles, again, they're split graphs with 6th and 8th graders on one, 10th and 12th graders on the other. 6th and 8th grade gambling, generally we're under the state averages for 6th and 8th grade. I guess that's good news. For 10th and 12th graders, 10th graders are pretty much equal to the state averages, and the 12th grade is slightly higher or equal to the state averages. Now we're going to look briefly at the risk factor profiles. When you look at the risk factor profiles, you want the risk factors to be low, and you want the protective factors to be high. I think we were pretty much similar to risk factors across the state. We were higher than the state on low commitment to school. Kids don't care about school. This is, half of the respondents in grade 6 marked that. Family conflict, we were higher than the state. Parent attitudes favorable to antisocial behavior. I'm scared to even think what that might be. Intention to use drugs, we're higher than the state. For 8th grade, we're pretty similar to state responses. It's not good or bad that we're similar. I would prefer that we'd be really different, though, like less or more, whatever's more favorable. Grade 10, we're similar except for parent attitude toward drug use, intention to use drugs for the individual, and friends who use drugs. We have lots of research that says if your friends use drugs, you're running with the wrong crowd if you want to get through school without having a drug problem. And grade 12 risk profiles, several domains were higher than the state. Examples are perceived availability of drugs. This means that kids believe, whether it's true or not, they believe drugs are readily available to them, easily available in our parish. Parent attitudes favorable to antisocial behavior and to drug use. So we need to get the parents on board. The last ones I have are the protective factor profiles. You want your risk factors low and your protective factors high, so we want to be above the state here. We were pretty much in the 6th grade at state level, except for two that I thought were really interesting. One is pro-social activities. These are school and community activities. Kids report that their perception is that there are lots of things to do here that are safe and good for them and interesting to them. But these are 6th graders now. The second one that I thought was very interesting is that there's a high degree of what they term religiosity. That's regular attendance at religious services. That's 6th graders. We see almost the same thing in the 8th grade profile. Again, high religiosity, and they added family attachment and opportunity for pro-social involvement. Now, unfortunately, I guess parents of 6th and 8th graders can make them go to church and make them, or encourage them to participate in certain activities, things like scouting and, I don't know, whatever the community has to offer. In 10th grade, I'm sorry, are we on the 10th grade screen? I can't see it from here.
We're 8th grade.
10th grade?
8th. Round 10.
Okay. In the 10th grade, we see a decline in religious attendance. We see the kids not participating. They still report opportunities for pro-social involvement, so they still say that there are things to do in the community, both at school and in the community. Very interesting to me is that we scored well below the state in social skills. And there's certain questions, I don't know what they are, that ask the student if they feel they have the skills to do this, that, or the other thing. And they're obviously here reporting no. And another one that disturbed me was belief in the moral order. Moral order is, we believe if we do the right thing and, go to work and do our homework, we'll come out well in the end. That's simplistic, but they do not believe that. They're reporting that. And for grade 12, the first one, opportunity for pro-social involvement, they're still reporting that. That's been consistent through all the protective factors. They also report higher than the state involvement at school and involvement in the family, which is good. They're below state on interaction with pro-social peers. This is having peers that are negative, a negative influence. What I've given you is a very brief overview. If you go to this website, you'll be able to see the whole report. You can also contact me. I've computed a lot of these things out, percentages and things that we use in grants. So do you have any questions? I'm sorry it was so brief.
Yeah, I have a question.
Sure.
Pertaining to one of your reports, I noticed you skipped over something, and I wanted to know what it was on this, what it was stating when I read it, trying to brush my memory up. Under personnel, you didn't mention that at all. I noticed you didn't mention that.
No, that's why I gave you the report with all the information, and then you can ask questions about certain things.
Yeah, I have questions about A, B, C, and D.
Okay.
Request to upgrade clinical manager position and salary level. What's that about?
Well, we talked about that in some detail. That's the clinical manager has reached the end of her salary scale. She can't get a raise unless we give her a different title and enter her into a new salary scale. And I had asked some time back to, I don't have the specifics with me, but I had asked some time back that we do that, and I gave a specific salary increase. I don't know what it is.
That's why, because when I see it, it's the upgrade manager's position.
Well, that's why we have to call her something else, and I had wanted to call her assistant director, and you all said you didn't want that, and so
That's in the bylaws. You have an assistant director. If something happens to Susan, Celeste is that, so you don't need that.
Well, that actually wasn't what I intended it to be. It was,
Okay, so you're saying you're changing?
No, I'm not doing anything. I'm just making a request to you all.
No. When we first discussed this, when you brought it to our attention before, about assistant to you, so now you're bringing it back again, and you're saying that you're not going to use assistant to you, but you want to use another name for the position?
I just took that out since you said you didn't want me to use it. She is my assistant. But
so why are you bringing it to us if she's already your assistant?
I'm bringing it to you because her salary is much too low, and she's been with the clinic 15 years, and she's an extremely valuable employee, and I would like to raise her salary. And also, we can't raise anyone else's salary below her until her salary is raised.
So in other words, you're saying the only way her salary could be raised is if title of her position be changed.
Right, because she's maxed in her scale.
Well, she already the assistant director, right?
Yeah.
Well, and she sees no
I mean,
clients.
don't get me wrong. Now, I'm trying to see where you're at on this, okay? Because what you're telling me is not what it's saying in the statement, okay? On the educational point of view, I mean, it's saying request to upgrade clinical manager position and salary level. When I read that, I'm thinking another position for a different person. Okay, that's the way I interpret it. Okay, but we can take it and flip it many different ways. That's why I asked.
Well, if you go back and read the minutes, I forget which meeting we talked about that in some detail.
Okay.
And,
I remember.
Well, why was,
and that's just
if
pending.
the salary is too low for the position she's holding, why do you have to change the name of her title to give her
Because
a
the
raise?
parish can't, she's, I don't know how to explain it. This is the information I got from HR, that we need to change her into a different salary scale.
But still, why do the name of her position have to be changed?
If
You
she
can give a
qualifies,
you
if
can
they,
give a person a raise and keep the same salary. I mean,
Only
keep the same
up to the
position.
end of their salary scale that they're in.
In other words, she maxed out
She's maxed out, right?
for that position that she's currently holding.
Right.
Okay, so she's maxed out as assistant director.
But
Is what you're
she's
saying.
functioning as assistant director, but she doesn't have that title.
She don't have assistant director pay.
Right,
Is what you're saying.
right.
So we clarifying her as assistant director, right?
No, we're not.
no,
So
I'm not.
Okay.
Because the ordinance states who the assistant director is.
Okay. So if we gonna follow the ordinance,
You can't
what is her
class.
title?
Her title is,
Right.
well,
Clinical
What is her
manager.
title?
Clinical manager.
Clinical manager.
Yeah.
And she's maxed out.
yeah. But in 2003, the Mental Health Board voted that we did not need that position. This board has never voted to restate that position, and so I was hoping that we would wait till we do the needs assessment and find out if we need that position.
Okay.
And all the other positions and what have you. But the board in 2003 voted that this counselor see patients, that we did not need
that's what-
two
that's
people
what-
to oversee 7 people.
That's why I was asking. That's why I asked the question that I asked, because I want to know for my interpretation, because it sounds like the director is trying to get her salary raised, but I mean, this is the way she's telling it to me, as if she can't get the salary raised with the title that she has.
That's
And
right.
That's my argument. My argument is why does it states in the ordinance there's a max amount clinical manager can receive?
Not in our ordinance, but it's stated in a parish policy and procedure manual as to how far they can go in each classification. And she's to the highest pay scale in her classification. So therefore, they have to reclassify her as something else to get her more money, regardless of what we think or what kind of job she's doing or anything. And we like I said, we have 2 people overseeing 7 people. I don't see that we need.
So as far as assistant director, we can just wash that out.
Right. Well, it's in your order.
Okay.
It's in your ordinance that
Okay.
your board secretary will automatically step in if something happens to Susan.
Okay.
Okay, my question is, what is the next position up from clinical manager?
That's what I was trying to develop.
What is it?
It's whatever we develop. There's no position in the parish scale right now,
For that.
except for director. That would be
I'm
the next
understanding that, but what would be the next position? Would it be
Director.
Okay, thank you.
position. Okay. Thank you very much.
There's a couple more,
Yeah, you got B.
B, C, and D.
Request to upgrade substance abuse
Well,
counselor
Mrs. Gotro
position.
said she wanted to wait to consider positions until the needs assessment. Didn't
But
We
it's
just
in the
making it
report.
clear.
I'm just
Making
wanting
it
to know
clear.
what it means.
Mm-hmm.
I mean,
Well, that would be-
we went through the whole report that she submitted, and she skipped over it. I just want to know why. I don't want to come back next meeting and all this is approved, and I don't know nothing about it, because it had happened before where things been on the report that she submitted, and we come back as approved, and we don't know nothing about it, and we surprised. So surprise me now. That's what I mean. That's what I'm trying to figure out. I mean, it skipped over. I just want to know why it was skipped over, and I'm trying to understand what it is.
Fine.
And don't get me wrong, I understand A quite thoroughly.
Okay.
Okay.
And then the second one is she wants to
Just
set
saying.
somebody up over just the substance abuse people, so that would be another higher paid position to oversee 3 people. So we keep pay scales keep raising, and we keep setting people up not to see our clients, where we need them to remain to see
No,
the client.
This person is a full-time clinician.
Yeah,
There-
but Stacy is not. She doesn't
There are-
see any patients right now.
There are a whole series of quality of reports that have to go to capital area and places that this person is already handling, and I would like to be able to recognize that.
So these positions that you're trying to trying to develop or trying to create, is this an ordinance? Can this be done? It can't be done, right?
It can be done if this board does it, but it can't be done otherwise.
That's why I asked to go over it. Because we'll fool around and come back next week and all this be approved and we want to know why. So we might as well blank it out. I mean, trying to figure out, like you say, make a motion that we table it until needs assessment.
Right.
Like he said, but I want to get a full understanding of it before we leave here tonight.
And if they're on the status report, we need to deal with it. Is it my understanding that most of the employees just receive a percentage, a raise?
The parish gave a raise in January, 4% or 5%, I'm not sure.
Okay, I understand right. Okay, thank you. And so D, under number 3 in personnel, you're requesting salary increases for all licensed counselors in 2008's budget to aid in the retention and competent counselors.
Right.
Okay, so we can deal with that at a later date, like
That's
we're
right.
saying.
That's right.
After the needs assessment, I'm sure we're going to need a whole lot of stuff.
That'd be great.
Thank you.
Thank you.
Okay. Number 7 on the agenda is to approve the DA's invoice. Is that in our package? Did anybody see that in the package?
Yes, ma'am.
It's in there?
Yes, it is.
Yes, ma'am.
And it's $2,000 and something dollars?
$2,607.23.
Okay,
Madam
that's...
Chairman, I'd like to make a motion that we pay the DA's
Second.
bill.
Okay. Very good. Number 8 is the budget. And Celeste is, we went in Wednesday and we discussed the budget with Celeste, and there's a bunch of things over budgeted, a bunch of things since we changed our charging practice from having a 3 departments into one. Well, we haven't quite gotten our paperwork straightened out with that. But we talked to Celeste, and I talked back with her today, and she said it's being taken care of. And we got to get ready for the budget for next month, and I did come across a couple of questions, but I had asked Celeste about them, and she said she was going to take care of them. And we're falling in the budget of last year's budget with what we're spending right now. Anybody got any questions about anything on that budget that she handed out last time? Okay, no questions.
No questions.
Under old business, we have our needs assessment, and we received a letter in the mail telling us what their plans were.
Yeah, and I spoke to one of them today, prior to this meeting, and she want to meet with the ministers in the area in Donaldsonville. She want to go to the doctor offices. She want to go to every church on the other side of the river. She want to go to daycare centers. So I give her a list of all of that, and probably tomorrow I'm gonna see if I can schedule an appointment with Mayor Sullivan and even the council, the whole council in the city of Donaldsonville, so we can get this program moving. Because it's very positive what they're doing, and I'm gonna support them 120% if I have to. Even if I have to go knock on somebody's door, I'll do that. So I spoke with her a long time today, right before I got here, and she has some positive things that we need to look at.
Okay. Now, she wants to meet with us on August the 6th at 5 o'clock. And Celeste is trying to schedule this building for us to have it in, and as soon as she gets it scheduled, it will go out on the email. Let's see, I will get you
What day of the week is that?
That's Monday. Uh-oh.
Y'all don't want to come across the river?
I don't mind going across the river. And we'll have the next one over there. How about that? 'Cause
That's
they're
fine
going to
with me.
meet that with us several times. And Mr. Noble and I also volunteered to do any legwork or anything with any part of the parish that they need. And I invited Miss Cheryl Fontenot to that meeting, and I also invited the lady I was just talking about with the parish, Cynthia Stafford, because she's telling me about a bunch of grants that's available for mental health funds, that there's no matches, and a lot of things that's going on that we're not up to date on, and I thought we'd get some input from her. Other than that, it will be just the board meeting with her, and if it's okay with y'all, I did invite those two people. Thank you.
Okay, I did talk with the Needs Assessments Director, and she said the same things. I talked to her this afternoon, too. So, and I also volunteered my service to Mr. Bryan, and I talked, and if he has to work and run his businesses, then I'm going to do his footwork, his leg work for him. But it's a parish thing. It's all over the parish that she wants to cover the whole territory.
Yeah. And Ms. Fontenot, any churches, any group sessions, anything that's going on anywhere that this information should be put into? Anybody lets you know anything? Bring it to us. We're going to see to it that
it can be advertised through the.
It should be.
I'm asking a question. I don't know.
Yeah, it should be able to be advertised that we're doing the needs assessment.
So
Anybody interested in helping it?
Be responsible for getting that attached to that, or
We can take
we
care of
can
it.
take it out?
We'll get the needs assessment to handle it.
And the public is being notified right now as to the help that we need from them, and we'd like to thank them in advance.
Okay.
Madam Chairman, could I say something?
Yes, sir.
I just want to thank Dr. Susan for the youth survey report. It was very good and informative and interesting, and I'm sure it took a lot of work and to get that done. And it tells us a lot.
At least
Thank
the
you.
kids are doing anyway.
Thank you very much.
Okay, under old business, Jerry, we have the Donaldsonville building.
I'm gonna have to push that to Mr. Bryan right now. He basically brushed me up. I'm wondering why we ain't got no paint going on.
I thought it was the rain.
Well, maybe the rain. I don't know.
Yeah.
I don't know what's the hold up. Miss Susan, you know anything about that? What's the hold up? It's been turned over to maintenance.
It's not going to maintenance. We need a work order okayed, and then
You need to
been over a
check
month.
with your parish councilman
and the contractor.
let him find out where it stands. You know, in the parish hierarchy of once the job is let.
Because we can't
And the
order the sign until we get the building painted.
Correct. So my advice would be to check with your parish councilman, and he could answer that.
Will do.
Okay. Do we have anything else on the old business?
Have you received any information from the parish president?
No, the
No
parish
response.
president has not sent a reply to our request.
Okay. Well, based on our research from the homeroom charter, section 4-12, powers in general, it states without limitation of the foregoing authority or other powers given to it by the charter, the governing authority, who is the council, may, and this is section D, make investigations of parish affairs and make inquiries into the conduct of any department, any office, any agency, or special district of the parish, including the investigation of the accounts, records, and transactions of the department, the office, the agency, or special districts. Based upon, we haven't had a response from the parish president on the issue of the removal of the mental health and substance abuse director. I would like to make a motion at this time to refer this issue to the governing authority.
I second.
Okay, motion made to refer the matter of the mental health director to the council underneath section 12-4.
Section 4-12.
Section 4-12.
The homeroom charter.
The homeroom charter. All right. So we will write, Ms. Celeste will write it up for us, and we will give it to Ms. Fontenot, since you represent us.
Ms. Suzanne?
Give it to Ms. Suzanne. All right. You need to vote on it.
Yes.
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 Made the
Yes.
motion.
Okay, it passes, so we'll take care of that. Okay. Any new business? And a motion to adjourn?
I motion that we adjourn.
Second.
Motion made and seconded that we adjourn. I need to put that in Wendy's paper.